My name is Leslie Boyer, MD, and Director, Viper Institute. The Viper Institute uses clues from the genealogy of venomous creatures worldwide to help people. We search out the ingredients in different venoms to find out what they do to people, how they might be useful to us, and most importantly, we develop antidotes so that people all around the world who are bitten or stung by snakes, spiders, and scorpions will have a safe treatment. Even though antivenom is an old-fashioned concept, we've got terrible shortages of necessary antidotes. There are millions of people bitten by snakes and stung by scorpions each year around the world, and hundreds of thousands, perhaps millions, of deaths associated with that. My own research is clinical research. I work together with other members of the Viper Institute who are biochemists and veterinarians and who develop new antivenoms. And then it's my job to figure out how can we safely test them in real live patients. We had a big triumph in August of 2011 when our scorpion antivenom actually made it all the way through the FDA. The impact in Arizona is that we now have a way to keep about 250 children per year out of intensive care. For those that live in remote areas, rural areas, we're probably saving a number of lives each year with this antidote. The impact worldwide is much greater because by working together with Arizona's clinical expertise and worldwide reptile and scorpion and chemistry expertise, we're able to develop products for Latin America and Africa and the Middle East that are going to help a lot more people than that. Making an antivenom is a wonderful use of what nature has given us. We take the actual venom from a scorpion or a snake, and we use it to make a vaccine, just the way you would make a tetanus shot for a baby, only we make a scorpion shot for a horse. You give him an immunization to the horse, and a booster shot, and another booster. And within a period of months, that horse is making so many antibodies that he's got enough to share. The horse then changes his career plan and becomes a plasma donor, and for many, many years may come in once a month or so and donate a little plasma. And our biochemists have developed tricks to purify the antibodies out of that horse plasma so that it's a safe material and doesn't cause so many allergic reactions. We put it in little bottles and we freeze dry it, and that is antivenom. Then it's my job and the job of the Viper nurses and pharmacists to figure out how to test that appropriately in human beings. The old antivenoms, developed 110 years ago, used to cause terrible allergic reactions. They were very crude products made from horse blood. But with modern technology, we've cleaned it up so much that it is 100 times safer than the old products used to be. There's no question the biggest challenge in bringing these things to market is that we're dealing with orphan drugs. In the United States, an orphan product means one that will help fewer than 200,000 people per year. Most venom problems in the United States affect fewer than 2,000 people per year. That's hard to study. We're very fortunate. The University of Arizona has received a variety of orphan grants from the FDA itself to help us to put this all together. It's tricky, and it took developing a really tight infrastructure for us to be able to study these things and to get enough information from patients that we could genuinely have a viable drug product at the end. We have so many ways that we can take this in the future that it's going to last long beyond my career. For one thing, there are venomous creatures of the world that have never had any antidote developed. Equally importantly, those same venomous creatures are making biochemicals that will be useful to mankind if we can just discover them and harvest them and treat our natural resources well. There will be new drugs and new products to help people coming out of these same discoveries for decades to come.